Physiology of sleep. Definition: sleep is the natural, periodic state of rest for mind and body, with closed eyes characterized by partial or complete loss of consciousness. Loss of consciousness led to decreased response to external stimuli and decreased body movement. Depth of sleep is not constant throughout the sleeping period. It varies in different stages of sleep. Sleep requirement. Sleep requirement is not constant. However, average sleep requirement per day at different age group is. For the newborn infants, it is about 18 to 20 hours, growing children 12 to 14 hours, adults 7 to 9 hours, and for older persons 5 to 7 hours. Physiological changes during sleep. During sleep, most of the body functions are reduced to basal level. Following are important changes in the body during sleep. Plasma volume. Plasma volume decreases by about 10% during sleep. Cardiovascular system, heart rate. During sleep, the heart rate reduces. It varies between 45 and 60 beats per minute. Blood pressure. Systolic pressure falls to about 90 to 110 mmHg. Lowest level is reached about 4 hours of sleep. Remains at this level till a short time before waking up. Then the pressure commences to rise. If sleep is disturbed by exciting dreams, the pressure is elevated above 130 mmHg. Respiratory system. Rate and flow of respiration are decreased. Respiration becomes irregular and tiny strokes type of periodic breath may develop. Gastrointestinal tract. Salivary secretion decreases during sleep. Gastric secretion is not altered or may be increased slightly. Contraction of empty stomach is more vigorous. Excretory system. Formation of urine decreases and specific gravity of urine increases. Sweat secretion. Sweat secretion increases during sleep. Lacrimal secretion decreases during sleep. Muscle tone. Tone in all the muscles of body except ocular muscles decreases very much during sleep. It is called sleep paralysis. Reflexes. Certain reflexes, particularly knee jerk, are abolished. Bensky science becomes positive during deep sleep. Threshold for most of the reflexes increases. People are constructed, light reflex is retained. Eyeballs move up and down. Brain is not inactive during sleep. There is characteristic cycle of brain waves activity during sleep with irregular intervals of dreams. Electrical activity in the brain varies with stages of sleep. Types of sleep. Sleep is of two types, that is rapid eye movement sleep or REM sleep and non-rapid eye movement sleep, and REM sleep or non-REM sleep. Stages of sleep and EEG pattern. Rapid eye movement sleep. During REM sleep, electroencephalogram or EEG shows irregular waves with high frequency and low amplitude. These waves are desynchronized waves. Non-rapid eye movement sleep. The NREM sleep is divided into 4 stages, that is based on the EEG pattern. During the stage of wakefulness, that is while lying down with closed eyes or relaxed mind, the alpha waves of EEG appears. When the person proceeds to drowsy state, the alpha waves diminished. Stage 1. Stage of drowsiness. Alpha wave are diminished and abolished. EEG shows only low voltage fluctuation and infrequent delta waves. Stage 2. Stage of light sleep. Stage 2 is characterized by spindle burst at a frequency of 14 per second, superimposed by low voltage delta waves. Stage 3. Stage of medium sleep. During this stage, the spindle bursts disappear. Frequency of delta waves decreases to 1 or 2 per second, and amplitude increases to about 10 100 microvolt. Stage 4. Stage of deep sleep. Delta waves become more prominent with low frequency and high amplitude. Mechanism of sleep. Sleep occurs due to activity of some sleep inducing centers in brain. Stimulation of these centers induces sleep. Damage of sleep centers results in sleeplessness or persistent wakefulness called insomnia. Sleep centers. Complex pathway between the reticular formation of brainstem, diencephalon, and cerebral cortex are involved in the onset and maintenance of sleep. However, two centers which induce sleep are located in brainstem, that is, raffinucleus and locus coeruleus of Pons. Applied physiology of sleep disorders. Insomnia. Insomnia is the irritability to sleep or abnormal wakefulness. It is most common sleep disorder. It occurs due to systemic illness or mental conditions such as psychiatric problems, alcoholic addiction, and drug addiction. Hypersomnia. Hypersomnia is the excessive sleep or excess need to sleep. It occurs because of lesions in the floor of the third ventricles, brain tumor, encephalitis, chronic bronchitis, and disease of muscles. Hypersomnia also occurs in endocrine disorders such as myxedema and diabetic insipidus. Narcolepsy and cataplexy. Narcolepsy is the sudden attack of uncontrollable sleep. Cataplexy is sudden outburst of emotion. Both the diseases are due to hypothalamic disorders. Sleep apnea syndrome. Sleep apnea is the temporary stoppage of breathing rapidly during sleep. Sleep apnea syndrome is the disorder that involves fluctuations in the rate and force of respiration during REM sleep with short apneic episode. Apnea is due to decreased stimulation of respiratory centers, arrest of diaphragmatic movement, airway obstruction, or the combination of all these factors. When breathing stops, the resultant hypercapnia and hypoxia stimulate respiration. Nightmare. Nightmare is a condition during sleep that is characterized by a sense of extreme uneasiness or discomfort or by frightful dreams. Discomfort is felt as of some heavy weight of stomach or chest or as uncontrolled movement of the body. After a period of extreme anxiety, the subject wakes with a troubled state of mind. It occurs mostly during REM sleep. Nightmares occurs due to improper food intake, digestive disorders, or nervous system disorder. It is also occurs during drugs withdrawal or alcohol withdrawal. Night terror. Night terror is a disorder similar to nightmare. It is common in children. It is also called pavor nocturnus or sleep terrors. Somnambulism. Somnambulism is getting up from bed and walking in the state of sleep. It is also called walking during sleep or sleep walking. Nocturnal enuresis. Nocturnal enuresis is an involuntary voiding of urine at bed. It is also called bedwetting. It is common in children. Movement disorders during sleep. Movement disorders occurs immediately after falling asleep. Sleep starts or hypnic jerks in the common movement disorder during sleep. It is characterized by sudden jerks of arms or legs. Sleep starts is a physiological form of clonus.